Hello, how are you? You doing okay? Can I get your name and date of birth? Alright, patient state's name and date of birth. I'm Jake, I'm gonna be your nurse today. So, doctor ordered a Foley because you have some retention. So we're gonna put a Foley in. Is that okay with you? Cool, okay. I'm gonna raise you to a good working high. Now, if you feel uncomfortable or have any pain or need me to stop, you can press that call button. I'll hand it to you in a second. I'm going to get this Foley kit ready. So I'm going to ask you about your allergies. Are you allergic to anything? Make sure the patient's not allergic to iodine. I'm going to take my kit out. Before I do that, I'm going to do some hand hygiene. I don't see any Purell anywhere. Hand hygiene. Take my kit out. So this kit was previously used, but I'm going to do my best in maintaining my sterile field. Do you have any questions about what I'm about to do? Is it going to hurt? Well, you might feel a little bit of pressure, but it really shouldn't hurt. It'll be pretty fast. Alright, I'm going to get the patient ready. I'll probably do hand hygiene again before I touch everything. Okay. And here's that call button. Alright. So I'm going to pull back the blinds, make sure to maintain patient privacy. Expose her so I can get a good view of her urethra. I'm going to go ahead, place my kit right here, making sure I got ample space to maintain my sterile field. I'm gonna put my gloves right here. I'm gonna do hand hygiene one more time. Hand hygiene one more time. Not allergic to iodine, right? Or CHG? Okay, cool. All right, we're gonna open up our kit. I am going to take this out, not going to use it. Alright, probably not going to use these either. I'm going to take these out. Okay, dog. Putting on my sterile gloves.
Make sure you know what the thumb is.
Sometimes that thumb is hard to get in there. It's going to be tricky. Bear with me. We are not going to break sterility.
I say, please.
I done lost my mind. I don't know what I was thinking.
I say, please
I usually
don't.
do the left glove first. That's what I was thinking.
So it'll start all over.
Oh no, we ain't about to do that. Well, if I can get this open. I'm sorry, Mrs. Jackson. These gloves, I think, have been in this position a long time. We'll get there. Great. Get that out of the way. Okay, sweetie. We're going to use some iodine. I'm going to open this up. Pour it on my swabs. You ain't got no swabs?
It's right there.
Oh, they're in here.
Yeah, it's 2 packs of swabs.
Oh, I've never seen it like that before. I've usually have to pour it. At my facility, I have to pour the iodine on the swab. Okay.
It must be cheaper.
We're going to take the iodine swab. I'm going to simulate that there's 3 of them in there. So this hand is going to become unsterile now because I'm touching her vagina. We're going to swab from the top down, that left labia. Then we're going to throw this over here in our trash. I'm going to grab another swab. Swab that left labia. Throw it in the trash, making sure not to go across our sterile field with anything dirty. And take that third swab. And go right down the middle. Down the middle. Alright, we got to expose that urethra. Okay. We'll set these over here.
You gonna do that with one hand? I said you gonna do that with one hand?
Oh yeah, I got it. I got it.
I got you.
I'm gonna get my jelly. It's right there. And then I'm gonna get my Foley. Probably should have done this before I started pushing her vagina, but I'll get it. I created a debacle for myself. Oh man, you got it in there in a loop. Lord willing. Okay. We got it, we got it. Okay. Alright, we're gonna lube up our Foley tip. Open up that labia. Making sure not to touch her vagina or anything surrounding. We're going to push as far as it takes to get urine flow, and then we're going to push about 2 to 3 more inches after. Then I'm going to take my saline. I'm going to make sure that we got urine output, because might have put it in the vagina. I mean the uterus. We're gonna blow up our balloon, making sure to look for how much saline to actually put in the balloon. And then throw that away. Gonna get our bag. If it has a stat lock, clean her leg, put the stat lock on, attach it right here, make sure it's not pulling. Check for any dependent loops in the Foley bag. Hang it below the level of the bladder. Clamp it to her bed. If she's confused, she might pull on it. Throw away all our trash. I'm gonna note the color of the urine, any sediment, its consistency, its viscosity, if it's thick or thin. I'm gonna note how she tolerated the procedure. Gonna document all that in the computer. She tolerated it well. How'd you do? You did good, huh? I told you it wasn't gonna hurt. Just a little bit of pressure. Okay. I'm gonna make sure you're comfortable, Mrs. Jackson. Okay, there you go. Well, I appreciate your time. How are you feeling? Better? Good. I'm so glad. Now I'm going to check her abdomen, see if there's any indication of that she's no more swelling in her belly. Going to press on her bladder, make sure she's not having any pain. I'm going to make sure she's comfortable. Put the bed back down. Give her the call light, ask her if she's hurting anywhere, and then throw away all my trash. Take my gloves off. Do hand hygiene. And then document accurately in the EHR. If she's confused, I'll put her bed alarm on. Ask her if she needs anything. You need anything, Miss Jackson? You good? You okay? Okay. Oh. I'm gonna take this label it 6/12/25, 1403, 6/12/25, 1403, my initials. Put it on the bag. Check how much is in it. Document that.
I think you got it.
And throw away all my trash. And tell her to call me if she needs anything. That's it.
All right.